am Dr. Phillip Chang at Aesthetica Cosmetic Surgery and Laser Center. This is Anne, and we're going to do a procedure today called a liquid facelift. Part one of that procedure is doing BOTOX for the forehead, or BOTOX for various other areas. So she was concerned about her forehead lines. She was concerned about the lines across the sides of her eyes, called the crow's feet lines, and she was concerned about these vertical lines that are also called the angry lines. So those are the three areas that are treated with BOTOX and treated well. The other area of facial aging for her was this lower facial area. And so we're going to put a little bit of filler right across there, and to improve the appearance of her cheek as well as the appearance of her lower eyelid. And when that's combined with BOTOX, that is the lower eyelid rejuvenation portion of this. The other areas of concern was this lower facial aging. You can see that she's beginning to have some jowling, some creasing across here, for that, we're going to put in some facial filler to be able to plump some of those lines out, but also to recontour some of her jawline, to camouflage this jowl notch of hers and improve the appearance of that. So, and finally, you can see she has some vertical lines on her lip. Her upper lip is a little bit thin, and so we're going to do a lip augmentation too. So we're going to start actually with the lip augmentation. When you look at Anne, you can see her lips. For a complete rejuvenation of the lip, the goals are to augment and accentuate this vermilion border, which is this white line outlining her lips. So that's one goal. The second goal is to improve and increase the show of this pink pulp of the lip. And what you want is that the lower pulp to be about 50% larger than the upper pulp. And then finally, by improving the appearance of this vermilion border, we can reduce some of these vertical lines across here, and by plumping up this area here, that we can improve the appearance of this pillars, and that will pooch up her lip just a little bit so that it shows her lip a little bit better. So, okay, we begin the lip augmentation by treating that vermilion roll. The needle goes in the side. Thread the needle through that roll. A lot of people do multiple sticks for this. I just do one. It creates a lot less bruising. You can see as I draw the needle, I'm filling it up, and you can see some of those lines just going away. That's exactly what she wants. Okay. So after we finish treating that roll, don't want to put too much there. The needle gets threaded back through the pulp. So remember, we want to increase the line, we want to increase the pulp a little bit. It's just one steady needle. And with that dental block, she's not even flinching. That looks really good. Okay, and we'll massage that out in a second. Okay, same thing on this side. Okay, so here. So that looks pretty equal. That upper lip looks great. I don't think she needs any more than that. That looks pretty good. Okay, so I do want to build up these columns a little bit, because when you build up the columns, it brings up her lip a little bit. Okay, so you do want to bring this upper lip up a little bit, not much. You can see how when I did that, it just turned that lip up a little bit. And that's kind of really what you want. There you go. Okay. Okay, so you can see some of those vertical lines got a lot better. The upper lip, the lower lip is slightly larger than the upper. This is already beginning to swell, so that'll go down. So we're gonna do the next step. We've just plumped up her lips, and what we're gonna do is use some Sculptra now to augment this area of her face, to give her a little bit more volume in her lower face. That loss of volume that she's had over time has led to some of the folding of her skin and wrinkling. So, okay, chin up, there you go. You can see the material going through, and you can, if you just look at her right cheek compared to her left, you can see that it's plumping up, and you can see how good that appearance is for her. Just that little extra volume. Okay, raise your chin. So if you just keep looking at the difference between her right and left cheek, you can see that there's a dramatic change for the better. A lot of this loose skin is being filled out, reducing a lot of the fine lines. And this is rounding out her lower face, which has lost a lot of volume. And so, instead of doing a facelift, we're just filling in this area. And so, if you again look between the right and the left side, you'll see that she has significantly less appearance of gelling on this side versus that side. Okay, and again, look between the right and the left. You can see the appearance of her eyes is significantly better. Okay, this line has less of a fold compared to this side, which is still a little bit flat. Okay, this fold is a lot sharper. Her jawline, again, is rounder on this side. Okay. I want to emphasize that this is not a facelift, but it's not a bad alternative either.